Hello everyone, and welcome to this audio podcast. This audio podcast is part of the ShiZMode chapter. This audio podcast is part of an analysis and expose in logistics. This audio podcast is part of the shitstorm and motley. This audio podcast is part of the jump off and as part of the segment V2 and a storm logistics production. Through this audio podcast, sort of continuing aspects of the introduction to works looking sort of collaborative works from 2019, looking at data for medicines optimization and best practice, and looking in around data insights into medicines use in care and nursing homes. A look at where between 2000 before sort of 2019 before 2019 there was a collaboration between a tech company an organization and an academic institution wherein the collaborative was wherein there was where there was where the collaboration involved an effort looking at putting forward sort of aspects of putting some aspects of sort of a sort of aspects of where works was aligned to a particular remit in a particular remit and where a particular tech remit in around where that collaboration had been sort of envisaged, and where the collaboration looked to attain data to better the care the care the medicines use and care for residents in nursing and care homes in those environs, and wherein the collaborative also looked to use electronic medicines administration record data or data analysis to optimize medicine use in care and nursing homes, and wherein additionally or in synchronicity also where there was where the collaborative also looked to ensure that that data analysis also propagated safety in the use and the prescribing and administration of in around prescribed medication or medicines and drugs and treatment modalities for residents in nursing and care homes. And so the in around the collaborative as well, the ideas or the under sort of underlying basis was also where the where in line to sort of additional aims and objectives, if you will, were that there where in the basis were to attain real-time data analytics on medicine use at individual home nursing and care homes, and additionally at group level. So, for example, or cohort level. So, for example, wherein residents in nursing and care homes, for example, if there was a cohort or a group if there was a group of nursing home residents in nursing and care homes, it was where a group within a nursing and care homes where they were on, for example, the same sorts of drug sort of medical treatment medical treatments or modalities, then the idea behind the tech and the analytics was that there could that is in wherein the analytics would then additionally see that there is a sort of a smarter way to ensure sort of optimization of pharmacotherapeutics in amongst residents in nursing and care homes. So this also included where the tech had a dashboard overview as part of the tech, and then where reports as part of the analytics and dashboard aspects, there were reports for further details in aligned to sort of the risk scores, sort of risk scores aligned to sort of algorithms that would prompt sort of a safer prescribing aspects pertaining to safer prescribing practices, but also aligned to safer administration in around treatment modalities, again in nursing and care home environs. In amongst this, additionally, there were several particular cohorts of particular treatment drug or treatment pharmacotherapeutic sort of group or cohorts. So, for example, aligned to the British National Formulary, or BNF, and that is so. For example, in nursing and care homes, those who residents who, for example, who would have been diagnosed with Parkinson's, sort of in around Parkinson's, those who were suspect or at risk for falling, for risks around falling, and also also aligned to gastrointestinal sort of conditions, and also sort of other conditions, such as aligned to those who will be suspect or at risk for infections, particular infections, and also in around pain aspects pertaining to pain and pain relief. For example, again in the cohorts aligned to those residents in nursing and care homes, and then also in around other particular specific and particular groups of residents in nursing and care homes. And the main basis at the time, additionally, was to assess really the four risks, four risks and in around four risks and aligned to the residents in nursing and care homes, and in around the medicines use sort of sort of aligned or pertaining to that. There in as part of the original works from 2019, there was a sort of a particular dashboard that was aligned to and specific to that particular basis of the collaboration from 2019. Additionally, we're in the follow-up audio podcast. There will be a look at sort of in around the looking at sort of polypharmacy, so multiple medicines used pertaining to different conditions that that the nursing home residents and care home residents would be at could have been at a suspect suspect or high risk for, but also and aligned to how particular polypharmacy or aspects of polypharmacy can or could be aligned to sort of aligned to where suspect or high risk for where residents could have had could be suspect or high risk where polypharmacy could implicate toxicity in line to what is referred to as nephrotoxicity, and where nephrotoxicity could prompt impairment in around renal, what is known as renal function. So the next audio podcast will look at this element and where this element or this particular element or aspect is aligned to an audio podcast series, the initial audio podcast series around the ShiZMode chapter, in as part of the audio podcast that looks at the shitstorm, Panzer, and the Geronimo. So the next, so this that now draws this particular audio podcast to a close. This audio podcast is part of the ShiZMode chapter. This audio podcast is part of the shitstorm motley. This audio podcast is part of the analysis and expose. This audio podcast as part of the analysis and expose and lobostics and the jump off, and this audio podcast as part of the segment of V2 and a Storm Lobostics production.